So it's important to have public health involved in dialysis because it's a very complex realm in process. You have both hemodialysis and peritoneal dialysis, and both of them have so many different steps that all it takes is one little spot and there's that opportunity for an infection to occur. And so, we at the Michigan Department of Health and Human Services, we strive to ensure that we are removing barriers of access and, reducing disparities of health with our residents in Michigan. And, this is one area where I feel we can really make a difference by teaming up with our network coordination providers, with our facilities, with our CMS regulatory, and with all of us working together. I think we can really move the needle in a positive direction to reduce bloodstream infections.
In Nebraska, for healthcare-acquired infection support, our program offers many different types of services. The most obvious type of service that our program would offer is if there's an outbreak of infections. That would be kind of the highest tier of a need for involvement. And that outbreak could be something like, we have 4 COVID cases that appear to be related to a dialysis center. Or harder to see, but very important, is when patients have a very resistant type of organism. And maybe we would find that that patient had care in acute care hospital, but they also dialyze in an in-center place. And so in those ways, even if it's not an organism that the healthcare team in the dialysis center would see, we would definitely need to be involved to make sure that other patients were safe, but also that the staff in those centers are safe. So that's outbreak support. I think that's the biggest, most clear umbrella. We also help facilities with prevention of infections. So a lot of health departments are staffed with people like myself who have a lot of experience in preventing healthcare-acquired infections. So I've been doing this type of work for over 15 years. I have a lot of experience in bloodstream access, for example, and the type of chemicals we use to disinfect the skin and the order of tasks we use to make sure that those pieces of equipment or the skin is kept as clean and aseptic as possible. So because I've lived a long time in that world, I can absolutely go into a dialysis center, just like I can go into an acute care facility and say, hey, maybe this would make your job a little more effective or a little simpler. Not asking for extra steps, not asking for extra things, but hey, I can use some of my experience in another type of healthcare and say, how can we make this job a little more easy for you? Or how can I help you? You're being real efficient right now. How can I help you just be mindful of this really important task in the middle and help you understand why that's important? So that's outbreaks and prevention-based visits and also education. So healthcare-acquired infections teams, I think a lot of people in the dialysis community don't necessarily know what we're doing and what we're available to do. One of the things that we like to do from a healthcare-acquired infections perspective is offer education. My team in Nebraska, we've been working really hard for years to try to bring great education to people at a low price. And so in a lot of cases, that's free. But I can get you continuing nurse education credit so that you can keep your license. I can, if it's difficult for you at a dialysis community to come up with how do I train my dialysis technicians on hand hygiene, for example. I've been doing that for years. I would love to help you with that, and it doesn't cost anything. When you're working from an HAI program perspective, that's your tax dollars at work.
So our team has recently joined the coalition last year, and we received a lot of consultation resources for infection control practices, and it subsequently allowed us to become better partners to the dialysis facilities serving LA County.
So the MDS Coalition provides a unified voice in the dialysis community. So I think the CDC lends a really important and trusted name to infection control methodology. And so the MDS Coalition materials, when the CDC says that these things matter, then I believe that providers know it's trusted information and it's worthwhile. It's practical information that should be implemented. And so in that way, the MDS Coalition materials have made those standards available and unified between facilities. We know the bigger corporations sometimes have even more materials, but especially for our independent facilities, it's very important that they can access trustworthy, evidence-based, practical infection prevention materials that do not cost. And so in those ways, I think the MDS Coalition is really helping.
I think it's vital to be a part of the Making Dialysis Safer Coalition. I was actually a member in the acute care setting side. There's not a lot of infection prevention dialysis training in our certification for infection control exam. And so what we're finding is as we have these new IPs coming, they're novice and they're unsure where to even start in those dialysis centers. And so I used to use your checklist all the time to go through and be able to, just day to day when I walk through, it started conversations with the people doing the dialysis, whether it's that staff or if it's a vendor coming in. And I encourage them to also join the coalition because together we can all start collaborating in a positive way.